Hi, everybody, and welcome back to everything you need to know about going to the ER. I am Amy, and I'm back with you today to talk about chest pain. Since last time we talked about your heart, I wanted to follow up today with a really common complaint that we get in the ER, chest pain. Because let's face it, having chest pain is scary. So, today I'm hoping that the information I share with you can help you decide whether your chest pain is an emergency or not. Okay. Disclaimer, the following information is just that. It's just information. It is not to diagnose you with a medical condition. So here we go. There are non-cardiac reasons for chest pain, and there are cardiac reasons for chest pain. Again, the word cardiac means heart. Now, when you go to the ER, they will get a good history. They're going to ask you questions like, what were you doing when it started? Does anything make it better or worse? What type of pain is your chest pain? Is it sharp? Is it pressure? Right? I think we talked about this in the triage video. You will most likely get an EKG. We talked about that last time in the video called Your Heart. You'll most likely get an EKG. You might get a chest x-ray. You might also get some lab work. I want to talk about one lab in particular called troponin. Troponin is a protein that's found in the heart muscle. And when there is damage to the heart muscle, there is an increase in troponin in your blood. So the people at the ER will check your troponin when you initially arrive. And probably 1 to 2 hours later, they will check it again to see if it's staying the same or rising or going down, right? You want to trend that troponin. This should give the doctor a good picture of whether this is a heart-related chest pain or a non-heart-related chest pain. Let's start with the cardiac or heart-related reasons for chest pain. So last time we talked about the arteries that surround your heart. These are called the coronary arteries, remember? And they supply the heart muscle with oxygenated blood, right? So when fatty deposits called plaques build up in these arteries, that's what's called coronary artery disease, or CAD for short. So I know pictures help me. So this is a picture of what a healthy artery looks like at the top there. Healthy artery, there's none of that yellowy fatty plaque, right? So as you go down, you can see that because of diet and sometimes genetic related problems, these fatty deposits start to happen. So initially, it's fairly small, but as these fatty deposits build up, you'll see that the plaques start to obstruct the blood flow, right? And then the picture down at the bottom, near complete blockage. Now think about your bathtub drain, right? When hair and junk gets caught in there, the water doesn't want to empty out of the tub, right? It takes extra long time for the water to empty. Well, now picture that in one of your coronary arteries. That blood flow is not going through quickly. It's being impeded by those plaque deposits. And this can lead to something called angina. So, angina is just that, it's chest pain caused by a reduced blood flow to the heart during exertion or stress. So, when your heart requires more oxygen because you're busy, you're active, you're swimming, you're walking, and all of a sudden you get chest pain, maybe even shortness of breath, when you sit down, rest, and that chest pain goes away, then you have to start asking yourself, was that angina or something else? So this is actually a warning from your heart, and don't ignore the warning. So if this is happening to you, go see your doctor. They might want to put you on some medications and then have you follow up with a cardiologist and take a stress test. Now, we all know what's coming next, right? If angina is a warning, what happens when those plaques build up to almost full occlusion, or you get a blood clot in there, which causes full occlusion, and that part of your heart is not getting oxygen? What is that called? right? Heart attack, or what we call myocardial infarction, or MI for short. And obviously, this is an emergency. Call 911 if this is happening to you. Classic symptoms of a heart attack: crushing chest pressure. You'll sometimes hear people say it's like an elephant sitting on my chest. Shortness of breath, nausea, vomiting, breaking out in a cold sweat. The person becomes pale. All of these symptoms put together is classic chest pain due to heart attack. So the remedy, as I said, call 911, get to the ER. They will rush that person to the cath lab. And in the cath lab, they do something called a catheterization. This is where they thread a small catheter through a vessel into the heart and inject dye to find the blockage. They can dilate that blockage with a balloon and then put a stent in it so it'll stay open. Now, if you have high blood pressure, high cholesterol, you're a smoker, you're diabetic, you have a family history of heart disease, you are at increased risk for a heart attack. So there can be other serious reasons for chest pain that are related to the heart. You can have things like pericarditis, which is an inflammation of the sac around the heart. Now, signs and symptoms of pericarditis is chest pain, shortness of breath, and most likely you'd have a fever. Okay, I want to go over one more serious cause of chest pain that's not necessarily heart related, but it is related to your aorta, which we did talk about last time. Your aorta is the main artery that's coming off your heart, right? That's taking oxygenated blood to the rest of your body. Now, sometimes there can be tears in the aorta, right? This is called an aortic dissection, a tear in the main artery that carries blood away from the heart. Now, the classic symptoms are chest pain radiating to your back or a tearing type of pain. This is also an emergency. Get to the ER. Okay, now let's continue with the non-cardiac causes of chest pain. Okay, there is one that can be scary, a pulmonary embolism, or a PE. Pulmonary refers to lungs. Embolism refers to a clot, right? A blood clot or another type of material can get lodged in one of the arteries in your lungs. And this also can cause chest pain that increases when you take a deep breath. It can also, of course, make it harder to breathe. So shortness of breath. Again, a PE can be life-threatening. So call 911 or get to the ER. Now let's continue with some other non-cardiac, less scary things that might take you to the ER because you're having chest pain. So indigestion, right? Indigestion. Gas or bloating in the stomach can sometimes feel like chest pain, right? Also, if you have something called GERD or gastroesophageal reflux disease, so GERD is also known as heartburn. And this is reflux of the stomach acid when it backs up into the esophagus and it causes sort of a burning feeling there, right? And it's usually in the center of your chest or maybe just below your breastbone, what we call the epigastric area. You can also get gas up in your chest. You can get gas that's lodged in your chest, and that can cause a sharp type of chest pain as well. So you can also get a variety of muscle strains or sprains in your rib cage or your chest area. So injuries to the chest muscles or ribs can also cause chest pain. Now, a recent history of working out or doing something active that you haven't done in a while can result in muscle strains or sprains in the chest area. Obviously, if you had recent trauma, somebody hit you in the chest, you were in a car accident, something like that, that can also cause pain to the chest cavity. Something called costochondritis, which is inflammation of the cartilage that connects the ribs to the breastbone. That can also become inflamed and cause chest pain. Typically, your pain gets worse when you take a deep breath. And this might be a common symptom if you've been coughing a lot because you've been sick or you're a smoker. You can also get infections or inflammations of the lungs, which can also cause chest pain. So, an inflammation of the lining of the lung is called pleurisy, and a lung infection itself is called pneumonia. Now, pneumonia tends to affect the elderly or the immunocompromised rather than young, healthy people with a good immune system. So, anxiety or panic attacks can also cause chest pain. If you hyperventilate, which means you breathe really fast for a long enough time, you can give yourself chest pain. And so, when you get the chest pain, that just makes you more anxious. So, that can be a really scary thing to develop when you're having an anxiety attack. Now, I want to mention again that if you have significant trauma to your chest cavity, you can get things like rib fractures or bruising of your organs. So if you've had a significant trauma, like you're in a car accident and your chest hits the steering wheel or something like that, if you had a fall from a very high place or you got hit in the chest, you can have rib fractures. You can also have things like a pneumothorax, which is like a punctured lung. Most people have heard of that. So, again, today's edition is meant to inform. It's not meant to scare you. It's meant to give you some tools to think through your chest pain. So, as a reminder, if you visit the ER because you're having chest pain, we are going to rule out the major life threatening causes, such as heart attack and the things that we've talked about so far. We might not be able to come up with the exact answer, but it's important to know that when you go to the emergency room, we will check you out for these life threatening causes. I also want to mention that if your suspicion is low for one of these life threatening causes, you can go see your doctor or go to the urgent care. So thank you for tuning in. I hope that was helpful information for you. Please let me know if you have any questions. Stay healthy, stay well, keep learning, and keep growing. Thank you.